You may be wondering, how is research different than the regular care I receive from my doctor? The main purpose of research is to create new knowledge for the benefit of future patients and society in general. Unlike medical care, research studies may or may not benefit the people who participate. Research is voluntary and you may change your mind at any time. There will be no penalty if you decide not to participate or if you start the study and decide to stop early. Either way, you can still get medical care and services from your doctor. Panda stands for Prenatal Autonomic Neurodevelopmental Assessment. Prenatal means before birth. Autonomic is the part of our nervous system that controls breathing, heartbeat, and digestion. Neurodevelopmental means brain growth, and an assessment is like a test or examination. The Panda study is measuring the effects of docosahexaenoic acid, also known as DHA. DHA is an essential nutrient and healthy fat that is found in fatty ocean fish like salmon and tuna, as well as in eggs. DHA is in all cells of the body, but is especially high in nerve cells of the brain and eye. If we eat foods with a lot of DHA, we may have more DHA in our bodies. Our bodies can make small amounts of DHA from other foods we eat. Babies get DHA from the mother when they are in the womb. After birth, they can get DHA from breast milk or infant formulas. Many studies have shown that DHA in the infant's diet may help vision development, attention, and their ability to learn. DHA may also be important before babies are born while the nervous system is developing. By doing this study, we hope to learn how much DHA to give to mothers in order to provide enough to the baby. We also want to learn if there are differences in development before birth. After your baby is born, we want to learn if there are differences in growth, how your baby pays attention to different sounds and sights, and how their brain functions the first year of life. Since we don't know what dose is best or how mother's diet affects how much DHA a baby gets, we are testing 2 different doses of DHA supplements, 200 milligrams or 800 milligrams, and are asking what women eat before and during their pregnancy. This will help us find out what dose is best for the developing baby. You will be randomly assigned, like flipping a coin, to capsules with DHA oil of either 200 milligrams or 800 milligrams per day. You will take these capsules as long as you are pregnant. Neither you nor the people in the research study will know which capsules you have been assigned unless there is an emergency. If you are eligible and decide to participate in this study, your participation will last from the time you enroll until your baby is 12 months old. You will have 3 visits before birth. The first one is today, 1 visit at delivery, and 4 visits after birth with your baby. All visits will be held at the Hoagland Brain Imaging Center except for delivery. If you choose to enroll in this study, we will get some information from your medical record about your pregnancy and medical history, and will continue to check your medical records throughout your pregnancy. We will also ask you questions about foods that you usually eat, alcohol intake, smoking history, and your race, ethnicity, education, and income. You will be asked for a phone number where you can be reached during the day. Today we will send you home with your first bottle of capsules. About 30 days later, enough so that you do not run out of capsules, you will receive a new bottle of capsules in the mail. At that time, we will ask that you place your used bottle, even if it is empty or has any remaining capsules, in the postage-paid envelope and put it into the mail. If you forget to take a capsule or miss a capsule for any other reason, you do not have to take more capsules the next day. You will also get a letter each month that explains what to do. The study team will contact you by the phone at least once per month. We will ask about how you are doing on the capsules and how much you are taking each day. Maintaining contact with our study team on a monthly basis is very important. After today, you will be asked to not take any additional DHA from other dietary supplements. This includes stopping intake of any prenatal vitamins with added DHA. You should continue to take any other vitamin and mineral supplements that do not contain DHA as recommended by your doctor. At 32 weeks, we will ask you to complete the same diet survey you completed at enrollment. We will also collect a small blood sample. At 32 and 36 weeks, we will measure you and your baby's heartbeat using a test called MCG. MCG is a special machine that records the electric signals naturally sent out by the heart. You should eat and drink a normal meal 1.5 hours prior to these visits. This is done to increase the chance of seeing your baby move during the testing. We will record your body weight, heart rate, and blood pressure before the MCG recording. We will ask you to change into scrubs and remove any jewelry. You should wear a sports bra or something similar with no underwire for the MCG recording. After you change, you will be taken to a testing room and asked to sit in an adjustable reclining chair designed to support pregnant women. Every effort will be made to make you comfortable in the chair. You should not proceed with testing if you are uncomfortable. Prior to starting the MCG, we will do an ultrasound examination to help position the machine. We will get a few basic measurements that will tell us how big your baby is and how it is lying in your womb. The biomagnemeter will be positioned to lightly touch your abdomen. After this is completed, we will leave the room and close the door. Someone may stay in the room with you if you like. We will be able to see you with a video camera. We can hear you and talk to you through a sound system. We will come in at any time if you become tired or uncomfortable. When the testing begins, we will ask you to hold still for a few minutes. We will first try to find the signals coming from your baby's heart. We do not expect the MCG recording to take longer than 45 minutes to an hour. At your 36-week visit, we will give you a phone number to call when you are admitted to have your baby to let the study team know you are about to deliver. Your baby's blood sample, taken from the umbilical cord at birth, will be given to the investigators. A hospital nurse will also draw a small blood sample, 1.5 teaspoons, from you while you are in the hospital. You and your baby will have 4 visits after delivery when your baby is 1 month, 4 months, 6 months, and 12 months old. During these visits, we will measure your baby's growth, brainwaves, and attention. At 1 and 4 months of age, we will measure your baby's body composition. To measure body composition, your baby will be placed on its back in a special incubator called a pea pod. The amount of volume, or space, occupied by the infant will be measured and used to calculate lean mass, or muscle, and total body fat. The staff and parent are able to monitor the child during the test through the clear top. Weight, length, head circumference, abdominal circumference, and crown rump length will be measured. Skin fold measurements will also be measured. At 1 month, 6 months, and 12 months, we will also record your baby's brainwaves by putting a safe electrode net on your baby's head. The net is made of sponges that surround each electrode. The sponges are soaked in a saltwater solution, placed on your baby's head, and fastened with a chin strap. We will play some sounds, tones, that will generate a brainwave. We will record your baby's brainwaves before and during the sounds and will compare the two. This will take about an hour. At 6 and 12 months of age, we will measure 5 minutes of brainwaves while your baby is resting by putting the same electrode net on your baby's head. Then we will show them pictures and will measure their brainwaves while they compare differences in the pictures. We will also record their heart rate while they look at the pictures. At 4 and 6 months of age, we will do an attention test. Your baby will be tested in a darkened room while seated in a car seat facing a flat screen monitor. 3 foam tabs with wires will be placed on the infant's abdomen in a triangular pattern to record their heartbeat while they take the test. A camera will be placed facing your infant so that we can record their attention and heart rate while they look at pictures of faces. There are minimal risks involved with this study. Drawing blood samples can cause discomfort and a small risk of bleeding, bruising, clotting, or infection. Standard hospital protocol and technique will be followed to ensure your safety and prevent infection. Right after your baby is born, experienced labor and delivery room nurses will obtain a blood sample from your baby's umbilical cord. This does not cause any pain or discomfort to your baby. You may experience burping from the capsules and find this unpleasant. The need to take capsules on a daily basis throughout this study may sometimes bother you. There are no known risks for taking the amount of DHA you will be given. The amount is smaller than pregnant women in many countries eat every day. As with any research study, it is possible that you could develop a problem that has not been seen before. To the best of our knowledge, there is no known risks associated with ultrasound or MCG measurements. The biomagnemeter does not emit electricity, magnetic fields, X-rays, or radiation. If you have a fear of enclosed or small spaces, someone can stay in the room with you. There are no known risks for performing the Peapod measurements on a newborn baby. The measurements do not cause any pain or discomfort to your baby. There are no known risks for performing the attention tasks. Babies may get fussy during the recording or may have a small irritation from the ECG electrodes. There are no known risks from having brain waves measured. Some babies may get fussy during application and/or removal of the electrode net on the head. You and your child may or may not benefit from being in this study. It is possible that you and your baby will get some benefit from being followed closely during this study. Researchers hope that the information from this study may be useful in understanding if taking DHA while pregnant can help babies. The cost of care for people participating in a clinical trial fall into 2 general categories. 1. Research costs, and 2. Routine care costs. The research costs associated with this study are the capsules and research procedures described in the consent form. These are provided at no cost to you or your insurance company. There will be a few blood draws for the study that may be taken at the same time as your standard blood draw during an outpatient clinic visit and will be taken at the same time as your standard blood draw when you come to the hospital to deliver your baby. You are responsible for your routine costs related to standard prenatal care, labor, and delivery. You may enroll in the study whether or not you have insurance. You will be given a CLIN card, which works like a debit card. At enrollment, you will receive $25 for the blood draw and history, plus $25 after completing the diet survey for a total of $50. You will receive $50 each for the shorter 36-week and 4-month visit. You will receive $50 for the 32-week visit, plus $25 for completing the 32-week diet survey, for a total of $75. You will receive $75 for each of the longer 1-month, 6-month, and 12-month visits, for a total of up to $450. If you do not complete all the study visits, then you will only receive payment for the study visits you have completed. This is to cover the costs of transportation and to partially compensate you for the time required to participate in the study. After the study visit, payment will be added onto your card by computer. The money will be available within 1 business day. You can use the CLIN card at an ATM or a store. No one at KUMC will know where you spend the money. You will be given 1 card during the study. If your card is lost or stolen, please call the phone number listed in your consent form. The KUMC Research Institute will be given your name, address, social security number, and the title of the study to allow them to issue a CLIN card for your study payments. Study payments are taxable income. A 1099 will be sent to you and to the Internal Revenue Service if your study payments are $600 or more in a calendar year. If you are harmed or experience other problems during this study, you should seek appropriate medical care and contact Dr. Gustafson at 913-588-0065 or the research nurse, Sherry Copeland, at 913-588-3140. If it is after 5 p.m., a holiday, or a weekend, you should call Dr. Gustafson at 913-703-6525. If you do get hurt as a result of participating in this study, treatment will be provided for you at the usual charge. Treatment may include first aid, emergency care, and follow-up care as needed. Claims will be submitted to your health insurance policy, your government program, or other third party, but you will be billed for the costs that are not covered by the insurance. The researchers will protect your information as required by law. Absolute confidentiality cannot be guaranteed because persons outside the study team may need to look at your study records. The researchers may publish the results of the study. If they do, they will only discuss group results. Your name will not be used in any publication or presentation about the study. Your health information is protected by a federal privacy law called HIPAA. By signing the consent form, you are giving permission for KUMC to use and share your health information. If you decide not to sign the form, you cannot be in the study. The researchers will only use and share information that is needed for the study. To do the study, they will collect health information from the study activities and from your medical records. You may be identified by information such as your name, address, phone, date of birth, social security number, and other identifiers. Your health information will be used at KU Medical Center by Dr. Gustafson, members of the research team, the KUMC Research Institute, the KUMC Human Subjects Committee, and other committees and offices that review and monitor research studies. Study records might be reviewed by government officials who oversee research if a regulatory review takes place. All study data that is sent outside KU Medical Center will have your name and other identifying characteristics removed so that your identity will not be known. Because identifiers will be removed, your study data will not be redisclosed by outside persons or groups and will not lose its federal privacy protection. Your permission to use and share your health information will not expire unless you cancel it. And that completes the informed consent video. Do you have any questions? Now is the time to ask. Thank you for your time and consideration.